Alrighty, welcome to my presentation. Sorry that I couldn't get into a more formal environment for this. It's not a great area to do this, but you get to see all these pictures of my lovely wife and my wedding and everything. So anyways, getting into it, my presentation is on the Phantom in the Brain. So this was the book that I had most interest in, and getting started into the psychiatric grand rounds, I will be talking about the intake form, or the intake report, excuse me. So the woman, her name is Ellen Bradford. I gave her the last name Bradford because I couldn't find her actual last name, if it was in the book or not. But it's fictional, so I figured that would be okay. So put her down as a 51-year-old Caucasian woman who was widowed and has one child, who is 17 years old. So she has completed her master's in linguistics, and she has a bachelor's in phonetics. And she works as a Ukrainian screener linguist full-time. So she was presented for a neuropsychological evaluation, which was referred by a Dr. Landon Strasser, who is a neurologist, and has been seeing signs of how Ellen Bradford has had brain damage in the right hemisphere. So this was all due to a stroke that she had because of a car accident that she was in. So it got damaged, the right hemisphere. More specifically, I might butcher this name, but it's the parietal lobe, which was the particular part of the brain, the right hemisphere, that got damaged. So yeah, this has impacted her life in a very weird way that I personally haven't heard of, but it's basically she can't deal with all things left. So, the right hemisphere, like the right side of things, she is completely fine to see and interact and deal with, but the left side, she has a lot of trouble. So vision in particular, she isn't necessarily blind to her left side, but there is this strong sense of neglect that she has, because she has a common neurological syndrome called hemi-neglect, I believe is the proper way to say it, but I could be wrong on that. So moving past, we will go and present the problem. So we'll be presenting this problem. So after seeing this neurologist, Dr. Strasser, is who we're naming, for around 2 months or so, she has noticeably shown signs of hemi-neglect through wild attempts of avoiding the left side of things. So she's been seeing him for 2 months, but that's kind of like the total time that she was seeing him. I'll get later on to like the diagnosis of this type of issue that she's dealing with, and it gets a little bit more specific. It's not 2 months that she deals with it necessarily, but so so there's sort of a danger that comes with this, because someone who suffers through hemi-neglect, it can be dangerous to themselves and others. If they just leave it completely untreated and they just go on with their daily life, there could be problems like they could be driving a car, for instance, and they don't really visualize the left side or anything of the road, or They could be walking in the street on accident or just like get lost in these things. So, although that's a little bit more rare for this instance, there are some extreme cases to where that could be a potential. So, this has ultimately affected her personal life. So this has affected her life with work, with home, with friends, family, and just everyday functioning. Really emphasizing on that everyday functioning. I mean, this has been a really tough thing for her to deal with. So after interaction with Ellen Bradford, this Dr. Strasser has seen how she has talked about how it's gotten to an extreme to where if she were to eat dinner, she can't even finish her meal completely because she'll eat the right side of the plate. Not the plate itself, obviously, but the food on the plate. She'll eat, the right side of the plate, but she doesn't touch the left side at all. So she has to just completely flip the plate around. It sounds almost like this scratch itch type of thing, made me think about OCD, but it is very different, and it is nothing like that. So there was an instance where her son, Sam is his name, whenever she came back from the hospital in the wheelchair, she got in this car accident, she ends up having this stroke, and then she ends up in a wheelchair. And then she comes back, and when she comes back, the right side of her entire face is, has makeup on it. She has lipstick, she has eyeliner, blush, whatever. The left side, completely untouched. So it's noticeable. You can see the difference between the left and the right. So you see that she just didn't do it. And she doesn't know this at all. She isn't aware that she just completely neglected the left side, which is part of human neglect. I mean, it's not even intentional for her. It's just she can't even think about it. She can't even fathom. So, so she, the left side just completely run down and incomplete. And from studies from Dr. Strasser, he has seen cases with people with a neurological syndrome, human neglect, to where there could be these extreme cases to where they're looking to buy a house, for an instance. So you have two identical houses, one on the left, one on the right. The one on the left is on fire, which is the part that she neglects and everything. But you see her even move more towards the right, not necessarily because that left is part of the neglect, but that left is on fire. And it's shown that she or he can sense that fire, and they can sense that danger aspect of it. So there's this danger that goes along with this fire, and she will just completely move away from it, move towards the safe house, and will naturally gravitate to that because she is able to sense this danger, which means she isn't blind to the left side. That means her, she can see the left side of things, but she still neglects it unless there is this strong sense of urgency or crazy movement or danger. So she moves on, goes to the right side of the house, and will take that one just because it's not dangerous. So yeah, Dr. Strasser would agree with this, and believes that they can sense danger, proving that this is neglect rather than blindness. So that will be all for that section. We'll move on to the behavioral observations. So because there were so many signs of like dysfunction within Ellen Bradford, which brought like a lot of concern from Dr. Strasser himself. He saw ways that she couldn't complete simple, at-home tasks. Like she couldn't take a shower by herself without, like she wouldn't wash the left side of her body. Like she would only wash the right. Or whenever she brushes her teeth, she only brushes the right side of her mouth. Things like this. So, there's this kind of dysfunction in the fact that she's not being hygienic, which can ultimately be a problem, especially with like teeth. Like, maintaining that flossing and brushing your teeth twice a day is really important, because that can be expensive to get teeth removal or replacements or things of that nature. So ignoring these things ultimately in the long run will hurt her. So it is important for her to maintain this cleanness. But some more examples of what I studied through the book would be like I said earlier, she'll only put makeup on one side of her face. She'll only shave one side of her body, which is the right side. And whenever she'll put a shirt on, she'll put the shirt on, but her arm is like not in the sleeve or anything. So it's just kind of dangling there. So it's like things like this to where, it's almost like the left side of her body doesn't exist like at all. So yeah, the only time that her left hemisphere of her body, or seeing things, the only time that kind of kicks in is whenever her subconscious is almost taking over and saying, hey, this is bad, that you're in danger, you need to get out of here. It's in that moment whenever she has that subconscious part of her take over. So to the medical history, age of 34, she gave birth to her first son, Sam. And this was one of the first times where she felt like this brutal pain. And then 5 years later, unfortunately, her husband dies, which leads to a history of depression, which really, hurts her mental state at this time. So 12 years after her husband dies, whenever her son is around 17, this is whenever she gets in this car accident. And this is the part where she ends up having the stroke and everything. So there's a lot of stress that's added to her at this point in her life that she is wanting to kind of move past, which is what her neurologist is kind of helping out with. So some of the test results was how Dr. Strasser, he wanted to conduct this test called HINTS, which is the Head Impulsive Nystagmus Test of Skew, which this is basically a way to like sense if there's going to be a stroke again in the future. It's actually a very effective way. It can be even more effective than some MRI tests to see if this is going to be an issue. So that was a test that Dr. Strasser wanted to put on her to see if anything was going to be, in danger for the future. And the diagnostic impressions. So, from studying Ellen, basically the running theory is that, she's displayed many of the criteria of this neurological syndrome, human neglect. So there has been, all these tests showing how she's not intentionally ignoring the left side of things, but she is just, it's just getting past her. This neglect is just stronger than her will. And something that she might have to do, some recommendations would be, if she's incapable of taking care of herself, maybe hiring a caretaker would be what is best for her. Finding someone that can help her with daily tasks, getting around, driving her, helping her bathe and eat and keep up with her, dental hygiene, things like this. She's needing to get that type of help. And typically people with hemoneglect only last around like a couple of weeks or so. It's like 2 to 4 weeks. If it continues after that, there could be the possibility that it is an indefinite thing, and tends to be indefinite after that 2 to 4 week period. A lot of people don't get a lot better, but there is a way to manage it. There's ways to manage it. And yeah, so just having that conversation of what your future is going to look like, if that is the case, is very important. And to make sure you're scheduling meetings with your neurologist to kind of keep up with what's happening with them and to let them know what's happening with you. It's just an important process to go along. So that is all I've got today for the presentation, but I hope you enjoyed. You have a great weekend, okay?